On this episode...
Just give him a little breath for me.
Poor little Mai is not breathing.
Come on.
With any dog going under an anaesthetic, there's risks of shock, sudden death.
Come on, Mai. Sleeping.
When you've got mammary lumps, we know that half of them are benign, half of them are cancerous, and even if you have small ones, they can grow. It's only small, but there is a little pea-sized lump there. It's down here as well, so we'll have to go a bit further down.
But first...
What's happened to Merlin? Oh no. You can see here quite a nasty fracture. He's got a fractured canine. You love him very much, don't you?
You're worried about Merlin, aren't you?
We've also got to think about the quality of life of that cat and consider whether Merlin, fortunately, should be put to sleep. Morning.
Hi.
What's going on this morning?
So we've just had a cat called Merlin brought in. Looks like he's got a severe trauma to his left leg. He's also had a knock to the head.
In North Yorkshire in the UK, Louisa is starting work and is immediately facing an emergency.
He's fractured some teeth. He's had some methadone to make him comfortable.
So I've arrived this morning and they've told me that there's a lovely cat called Merlin who's been hit by a car. He's stable, but we believe that he might have sustained quite a nasty break to one of his legs. There's a lot of swelling around here.
As well as a suspected broken leg, Merlin has suffered severe trauma to his head.
He's got a fractured canine and a fracture to the back tooth.
Anxiously waiting for news of their beloved 2-year-old is owner Jason and his young daughter Lily.
You miss him. Your best friend, isn't he? He's a massive part of the family. We've got 2 dogs as well, and it just plays with them. It's honest, it's like Tom and Jerry in the house. They just chase each other, lay with each other. The dogs are feeling it. They can tell he's not there, obviously. I just can't wait to get him back home.
Hello.
Yeah.
So I've got your little cat Merlin in, haven't I? Do you want to tell me what's happened to Merlin?
Got run over.
He did? Oh no.
It was my wife that found him. He was initially just lifeless laid there, and then obviously when she got closer, she seen the blood on him and the missing skin on his leg.
Yeah.
Tried to talk to him, and he just wasn't responding.
Yeah. It looks like he's damaged that leg, doesn't he? Because he doesn't want to use that leg. And that leg is potentially broken. So what we'll need to do is take some x-rays and then we'll make a plan together. So I will show you the x-rays. Hopefully it's something that we can fix. But if not, we'll make a plan together, and we need to get him sorted, don't we? We want to get him home. Yeah? Are you missing him? Missing him? Yeah, I bet. Okay, cool. I'll go and do that and then we'll go from there, okay?
Thank you.
So this is the x-ray. You can see here quite a nasty fracture to the top of the humerus, and it's in such a horrible place. It's all really swollen and really painful. We're quite limited with our options in this position of the leg, which is why we had to have quite a frank conversation with the owner. So I'm feeling really sad. The fracture could actually be the tip of the iceberg. We could be dealing with lots of other injuries, in which case we've also got to think about the quality of life of that cat and consider whether Merlin, unfortunately, should be put to sleep, because some cats might not recover through the surgery. It's not looking very nice for him. So we've got to have some quite serious conversations with the owner about where we go from here, really.
To the vets.
In Isleworth, London, Tracy is bringing her Cavalier King Charles Spaniel Mai to see Scott.
Come on, Mai. Mai's not a big fan of the vets, unfortunately. She gets quite frantic when we get through the door. She pulls all the way here, she just gets quite nervous.
The reason is chronic issues with Mai's anal glands, which have meant ongoing and unpleasant treatment for the timid 2.5-year-old.
It's quite painful for Mai every time they rupture, particularly, like they are literally creating a little hole in her bum that shouldn't be there, and it's not very nice for her. She's definitely quite uncomfortable.
Hi, Tracy. Hi.
Hi, lovely to meet you.
Right?
Yeah, really good, thank you.
Hi, Jen. Oh,
Yeah,
James is
sleeping baby.
Let's keep it down, shall we?
That'd be good.
Should we go into the consult room?
Brilliant.
I've had lots of practice. Shall I drive?
If you don't
Shall I
mind,
drive?
yeah,
All right, come on in.
fantastic.
Here we go.
Come on in, my Mai.
Nice and quietly, everyone.
Come on, sweetie.
Poor little Mai has had a huge amount of problems with her anal glands. She's had 4 anal gland ruptures. She's had many, many infections and huge courses of antibiotics. If they get an infection, they then abscessate and break out the side, and of course that will be very painful indeed. So anal glands really are probably the most poorly designed bit of anatomy on a dog. They originally are used to scent mark territory, so for wild dogs. In the case of companion animal dogs, what happens is the anal glands, they kind of build and build and build, and when they get to a certain size, they actually block their own duct off. And she is an example of a dog that's really suffered with anal glands.
Yeah. She's only 2.5 and it's already happened so many times, and the vet's explained it is likely to keep on happening, so actually we'd just like to get it solved once and for all.
That's a lot of pain to endure over the course of just a short 2-year lifespan.
Oh, she's such a chilled little dog. She's so lovely, so good-tempered, so tolerant with James and everything else, and with this as well. She's brilliant, so yeah. Mai is so sweet-natured to James. You want to sit next to my Mai? One of the few words that he knows is Mai. The two of them growing up together is really, really sweet. They're really, really lovely together. Lucky boy. I could not imagine not having her now. She is just always so happy to see you. She's just been an absolutely perfect addition to the family.
Yes, I can see a bit of scarring on the left-hand side, which is the most recent rupture site.
I think we, and that's including you, have battled valiantly to try and manage this without going down the surgical route.
Yeah.
But unfortunately, I think enough's enough.
Scott believes the solution is to surgically remove Mai's anal glands.
The rupturing does make my job more difficult because rather than having these pristine glands that you can see and you can inflate and you can remove, I'm going to have a lot of scar tissue.
Yeah.
And there are significant complications that come with performing surgery so close to the anus.
Yeah.
Worst case scenario, you can have an incontinent dog.
Yeah.
You can tell that Tracy's really nervous about today. Mai is kind of her first baby, the fur baby, and with James as well, clearly having a strong bond with the dog. It is a pretty big decision for Tracy to make. Do you want to give her a little bit of a kiss to say goodbye?
You be a good girl, yeah? Good girl, sweetie. You can be fine. Oh, bless her.
Come on then, here we go.
I know there can be a few side effects and a few things that can go wrong, so that makes it particularly nerve-wracking. We really hope it is worth the risk to get this operation done.
See you later.
Fab, thanks very much. Good luck.
All right, speak to you later. Thank
See you later, my Mai.
Bye.
Oh.
I know.
Sorry, my Mai.
I know. It's okay.
Do you want to come through? Do you want to see these x-rays?
Yeah.
In the north of England, Louisa is about to have a difficult conversation regarding the fate of Merlin. The 2-year-old cat suffered a severely broken leg when run over by a car.
Lily, this is an x-ray of Merlin. Now, can you see the difference here to here? The top of this bone here has completely broken off.
Merlin's owners, Jason and his daughter Lily, are worried the family's adored cat might have to be put down.
You love him very much, don't you?
You're worried about Merlin, weren't you?
As a cat owner, I do really empathise with them. You know, it's not their fault, accidents happen, and little Lily is definitely really worried. Do you want to listen to the heartbeat of Merlin? Okay, you hold that.
You hear his heartbeat?
Is he okay? Good. Lovely. So, I think best case scenario would be we amputate that leg. Okay. Cats recover remarkably well. Okay. I actually have a 3-legged cat. My 3-legged cat is called Oreo. I amputated her leg many years ago. I feel quite emotionally invested in this case with Merlin because I do have Oreo and she does have 3 legs. She came into my life very early on in my veterinary career over 10 years ago. She had a nasty fracture and I didn't want to put her to sleep. I wanted to save her, so I amputated her leg with the intention then of actually rehoming her, but she never left. So she's still doing exceptionally well with the 3 legs. It's not stopped her doing a thing. What I can do, Lily, I could show you videos of my 3-legged cat and how well she does. Would you like to see that?
That'd be good, wouldn't it?
Would you like to see them now?
That'd be good, wouldn't it? She looks really comfy, doesn't she?
Yeah, she does. And she's so happy. She's not had a front leg for almost 10 years now.
Merlin does that, doesn't he?
Does he?
When he's content, rolls over on his back.
Reassured by Louisa's personal and professional experience,
I promise you, he's going to be so happy and you won't even notice.
Lily and her dad agree to removing Merlin's damaged leg.
Bye, little fella. See you in a bit. Thank you.
No worries. I'll look after him for you.
Cheers.
Okay. See you soon.
Thanks.
Hi, Judith.
Hello.
So this is Mai. She has had so many problems with her bum.
In London, Scott's about to operate on Mai to remove her anal glands that have caused the 2-year-old massive problems her whole life.
She's off and on been at this vet practice since she was a puppy. So today I'm going to be performing bilateral anal gland removal or anal sacculectomy and hope that she's continent afterwards.
Of course. Fingers crossed.
Fingers crossed, exactly, yeah. She's such a lovely girl. There is a risk with this surgery because there's a huge amount of nerves around the anus. If you cut through them, sometimes the dog can become incontinent. Today is just about performing the surgery to the best of our ability. Hopefully she'll go home, no more anal gland problems, but still can control her bowels.
Sphincters. Okay.
You okay, beautiful?
A little bit sad at the moment.
Very sleepy.
Sleepy.
The surgery isn't the most glamorous, but Scott and Nurse Judith are besotted with all their 4-legged patients.
So I was that kid that used to just hug every dog that went walking past. Ran across to the next door neighbours, hugged their dog. We'd go over friends' houses, I'd sit outside and hug the dog.
I just grew up with dogs all my
So
life.
your dog was like your best friend at that age?
My parents asked me, "You want brothers or sisters?" I said, "No, I have my dog. I don't want a brother."
Tracy, the owner, came in today with James, her little toddler, who
the baby.
was chatting away about his Mai. So hopefully he'll keep napping whilst you have your nap for your surgery and then you can be reunited.
Yes.
But as Scott puts Mai under anaesthetic,
Like those happy drugs, didn't you?
the little dog is in trouble.
Poor little Mai is not breathing. Just give him a little breath for me. With any dog going under an anaesthetic, there's risks of shock, sudden death. Come on, Mai, sleeping. So we do need to perform a few techniques, stimulate her, rub her, and get her through this to start breathing.
The sweet-natured 2-year-old is suddenly fighting for her life.
This is a bit of a difficult surgery and I do feel a bit nervous.
In North Yorkshire, Louisa is about to start amputating the shattered front leg of car accident victim Merlin.
This is just a sterile bandage, which means that we can move the leg freely during the surgery. This is the one that will be coming off today.
Louisa has called on her colleague Emma to provide an extra pair of hands for the challenging and risky procedure.
I've got my lovely colleague and friend Emma. She's one of our other senior vets. And Emma and I are gonna have a lovely, smooth sailing surgery. We're gonna get Merlin fixed and off the table in no time. So I'm gonna start. The procedure itself is quite tricky because there's lots of muscles and there's lots of nerves and blood vessels and you've got to find them and take them off in a specific way, so it's not straightforward at all. We will be taking off the whole limb, including the shoulder blade. Oh my goodness, it's very awkward. The thing is, it's all very swollen, this leg as well, which can make sometimes finding your landmarks a bit more tricky. So, this is the hardest bit really, it's just kind of getting your bearings. But I think it's this muscle. Yeah, so it's this muscle here that's got to come off. That's got to go as well.
Having to cut through all these muscle, it just doesn't feel natural. We just have to keep reminding ourselves that it'll make much better quality of life.
If you put your fingers under there, look, so it's got to be under there, yeah, because that's the brachial plexus under there. Yeah, doing great. Doing a good job.
But as Louisa dissects the muscles connecting Merlin's damaged leg to his body,
Just dropping a little bit. Sorry.
suddenly the 2-year-old's condition deteriorates.
Blood pressure's dropped again. Right. So, can you do a little bit of a fluid bolus, please? We're going to make sure that we save his life.
Come on. Come on. Come on, buddy. Smoothing.
In London, Scott and nurse Judith are desperately trying to revive 2-year-old spaniel Mai, who has stopped breathing.
Just give him a little breath for me.
Giving Mai her induction anaesthetic, she just takes a little bit longer than we would like for her to start breathing. Now, a lot of dogs do react to that induction agent like that, but hers was just longer than is comfortable.
No, was there a little breath there?
Superficial.
She only had 2/3 of the dose as well. Okay. Ugh. It's all right.
Now.
She's keeping me on my toes, isn't she?
Yeah.
This job, hey, gives you more grey hairs every day.
I don't think that after 25 years of being a vet, I really need to be kept on my toes, but now Mai's breathing, hopefully the safe removal of her anal glands means that this dog won't have to keep going through all of this discomfort, all of these antibiotics needed to try and combat this condition.
Okay, so that one's actually pretty intact. This one is a real mess.
Now Mai's under anaesthetic, I get a chance to have a little feel of her anal glands. The right-hand side is fairly normal. It's full of a little bit of the discharge there, but fairly standard. The left-hand side, however, is very abnormal. It's very scarred, it's a bit lumpy, and as a result, that one is going to be a far harder challenge to remove.
That one's going to be tricky, so.
So what I'm doing here is I'm going to place this polymer into the anal glands. And what it does is it kind of makes them very clear, so I can feel they'll be quite enlarged, and then this solidifies, and it's kind of like removing 2 olives. My nice green polymer is all solidified. Now I have to remove the glands. So for the next hour or so, I will be focusing on possibly Mai's least most attractive feature. You are cutting in an area that's full of nerves, so you just have to be careful and take your time, breathe, focus, and just know what a nerve looks like and know not to cut it. The surgery itself is just really tricky. It's difficult to probably see in there. All the tissues are about the same color, so there's a lot of pressure on this. Ella, can you get that light in there to shine through the window and into my butthole, please? It's not mine, personal butthole, but that one. Oh. That's it, and then you know what you're shooting for. Going, yes, beautiful. Thank you. It's just really, really challenging as a surgery to make sure you're removing the right thing and you're not cutting the wrong thing. So you're trying to make the smallest incision and sort of be like a thief in the night and get it out. Okay, so that's one. The first gland does come out pretty easily, but the second gland is more challenging. It's far more attached to a number of tissues around the outside. There's quite a bit of bleeding.
Blood pressure's dropped again. Right.
In Yorkshire, Louisa and fellow vet Emma have hit a major hurdle as Merlin's blood pressure drops during surgery to amputate his front leg.
Can you do a little bit of a fluid bolus, please? We are noticing changes to blood pressure, we are dropping temperatures, but we have things in line to sort of try and mitigate that.
Blood pressure's back to normal.
The 2-year-old's vital signs are now back within a safe range.
So yeah, he's really settled, his temperature's come up nicely, blood pressure's normal.
Be really careful in this bit. We're just getting to the slightly scary part. In the armpit, there's a bundle of arteries, veins and nerves. And so we're going to try and find them. So we're going to put local anaesthetic in the nerves, because unfortunately we obviously have to cut them. And then we'll find the blood vessels, tie them off, and then it's just a case of careful dissection to try and get the rest of the leg off without causing any further trauma to this poor little man. It's like a very busy road map. I'm getting quite stressed when I'm in there because there's lots of stuff going on. So there's lots of nerves and lots of, you know, these important blood vessels that if you don't find and tie them off, you're going to have quite a big hemorrhage. Sorry, mate.
Tensions are high as Louisa and Emma work through the most critical part of the operation.
He's trying to like...
I know. Sorry. The muscle, it makes me jump. So it's
I stabbed you then.
No.
Can't be blocking your fingers.
It's fine. So it's totally normal to have muscle twitching. The Merlin can't feel it, but it means that you know you're in the right place. So we're blocking the nerves that go to the muscle.
What sharp fingers.
Finally, after a few scary moments,
Okay, and there he is. So relieved that the leg's off, but really sad as well because it's just, I don't know. It's just really sad to know that you've removed a leg, but you know that it's the right thing. Goes against your values, cutting things off when you actually want to put them back together. So now my job is to put him back together and have a lovely, nice wound for him to go home with. Right, sweetheart, your new life begins. Okay, that's us done. I'm really pleased with the way it looks now. It's nice and cushioned, so when he ultimately lies on it, it won't feel uncomfortable because we've removed the shoulder blade, and sometimes if you leave the shoulder blade in, it can be quite bony and a bit uncomfortable. So yeah, I'm pleased, and now he's just got to recover. Right, sweetheart. Good boy.
That's one.
in London, Scott is having difficulty removing the second of 2 anal glands that have caused a lifetime of grief for Cavalier King Charles Spaniel, Mai.
So I'm just recatheterizing the anal gland just to basically get my bearings, just see where it wants to come out.
Performing this surgery, I realised why I don't like doing this surgery, because you're constantly focused on a dog's bum, which is not very pleasant. But also the surgery itself is just really tricky. If you cut through the nerves around the anus, poor little Mai can become incontinent.
Yeah, it's a real mess under here. The gland is just really damaged, so it's likely going to be more of a piecemeal removal of the remnants of the gland.
After an hour of painstaking and high-risk surgery, Scott finally has removed both of Mai's troublesome anal glands.
It's not the most pleasant of processes, but with patience, a lot of deep breathing and some muttered swear words, I think I've got there. There we go.
Well done.
Well done.
Beautiful.
So the surgery itself is a success in that the anal glands are gone. So we shouldn't have any issues at all with anal glands as a result. It's just whether there's been any damage to the nerves present around the anus leading to fecal incontinence, and the proof will be in the pudding. So we'll just hope that she's able to control her poos.
So the moment of truth, I'm just going to check the anal tone just to see if her anus puckers, to just sort of show me that she still has sphincter control. It's not hugely puckering at me at the moment.
But the initial anal tone test is not promising.
She's still a bit sleepy, so we'll try again later when she's woken up more effectively. Hi, baby. Okay, hopefully that's the last time I have to focus so much back there. Definitely not the nicer end. Oh, yeah, you're a good girl.
Hello. Oh, good boy.
In North Yorkshire, Louisa is checking Merlin, to see if he's recovered enough to go home after his badly damaged leg had to be amputated.
He's doing really well. He's just recovering nice and slowly. He's got some strong painkillers.
Are you looking forward to seeing him, picking him up and getting him home? Yeah, me too.
Jason and his daughter Lily can't wait to see the family cat they love so much.
Constantly thinking about Merlin and shall I ring up? Are they going to ring me? Hope the operation's gone well. Really excited to see him.
Let's go and get your mum and dad. There he is.
His son.
Feeling a little bit snoozy, okay. He's a little bit tired. He's going to have some pain relief, but otherwise I think he just needs some quiet time, yeah. He's so brave, isn't he? He's so brave.
Yeah, there's one in the cage.
Brilliant. Yeah, that's where his leg was. You okay? So that's his scar and that's his scar. So he's so brave, isn't he?
He looks really strange, doesn't he?
Are you okay? He's so brave.
Right.
He's gonna have. He's so clever. It's just so nice to get them back together. He's such a lovely cat with a lovely family, and I'm really confident that he's going to make a nice recovery in no time.
I'm relieved to have him back and alive, I'll be honest.
He's been gorgeous. He's been an absolute trooper. Do you want to help me put that on? Well done.
With Merlin's owners keen to take the 2-year-old cat home, Louisa has instructed the owners on how to keep him comfortable overnight.
Shall I see you soon? Yeah?
Go on, you.
Right.
High five.
Yeah. Your job's to look after. You
Thank
take
you very
care
much
anyway.
for all your
All
help.
right.
No, much appreciated.
Thank you so much. See you later.
Thank you.
Look after him for me. Do you want to cuddle?
Yeah, what you do.
That was nice. Thank you. See you. Bye.
Thanks, Louisa.
See you
Cheers.
later. Bye.
Bye. You excited?
Good girl. Okay. Sorry, honey. I promised you I wouldn't be messing with your bum anymore.
In London, Scott is doing another test with Mai, hoping surgery to remove her anal glands hasn't left the young spaniel incontinent.
Oh, baby. I know. Yeah, it's good you can feel it. Yeah. Okay. Now I know that she hopefully won't soil herself. She can have her tail back. Good girl. Here we go, brave girl. You're so beautiful, aren't you? Oh, I'm so glad now I can focus on your beautiful face. Hey?
Relieved Mai's back end appears to be working normally,
Good girl, good girl.
it's time to reunite the 2-year-old with her loving owner Tracy.
It felt like a long afternoon, to be quite honest, just desperate to see her now. James will definitely be happy to see her when he gets home. She'll run in the door, she'll be all excited to see him. My.
Okay, you ready? Let's go see Mummy. Oh, good girl. Come on, then. Good girl. Hi. Say hi, Mummy. Hi. Hi. Guess what I don't have anymore? Anal glands. Yay!
Oh, sweetie.
You're very happy, aren't you? My gosh. Yes. So I'm really excited to reunite Mai with Tracy. They obviously have a really close relationship, and hopefully she'll start toileting normally very quickly, and that's the end of her anal gland problems. Well, she's done very well. I've actually just checked her anal tone. There's a little bit of movement already, so that's
Okay,
really good.
Yep.
So I feel confident that we're going to be good, and obviously we'll be able to develop a relationship that doesn't require me to mess with her bum.
Yes,
Which will be
please.
fantastic.
Yes, I imagine.
You keen to get out of here? Yeah.
So thank you. Definitely a relief. I mean, I'm so glad it worked out. Really, really happy.
All right, see
Thank
you
you
later.
so much. Cheers.
All right, bye. Good puppy. See you later. Ah,
Thank
she's
you.
free. Free from the butt doctor.
Good girl. Come on.
In North Yorkshire, Tom and Lynn's little dog Daisy has some worrying problems, and they've brought her in to see Louisa.
She's a rescue dog. We got some 6 months ago, and when we brought her in for a check, they found she had growths on a mammary gland. She's had one side done, and today we're hoping they're going to do the second side, and hopefully she'll be a lot better than what she is.
Daisy, please.
Come on, Daisy. Good girl. This way. Come on. Good girl. She was a bit sick yesterday.
Okay.
And she's been a bit shivery this morning.
Okay.
She's okay at the moment.
Hello, my love. Are you a bit nervous? She's very quiet, yeah. So she's already had some tumours removed from one side of her mammary area, hasn't she?
Right, yeah.
And we're due to remove the other side because she's got other tumours. But you're just not quite sure whether she's been herself overnight.
Yeah.
Hello, sweet.
She's eating well and everything.
Good. Going to the toilet okay?
Yep, smashing.
Daisy's previously had what we call a partial mammary strip, so we've taken a few teats away from one side that had benign tumours in them, and she's now developed some on the other side which she needs to have removed before they turn into something nasty. And did she recover okay from her last general anaesthetic?
In no time at all,
Good. She seems really comfortable on that tummy, really comfortable.
Good, excellent.
Are you alright to lift her up for me so we can have a look at these little lumps?
Yep.
Oh, sweetheart. So yeah, we can obviously see where she's had this side removed. She's got some little lumps in there. Sorry,
Steady,
sweetheart.
steady there. Steady, you're okay.
It's okay. Are you dancing?
Go steady.
You can put your feet on that back
That's
there.
it, good girl.
And then obviously we've got these bigger lumps hidden in here, haven't we?
Yeah.
Because the lumps are only in the last two teats, we will take both of them off.
Right.
Because these lumps, when you've got mammary lumps, we know that half of them are benign, half of them are cancerous, and even if you have small ones, they can grow, even small benign ones, so we take them off, so they don't cause you a problem in the future. So she'll come in with me, she'll have a blood test, she'll have her anaesthetic, we'll whiz it off, and she'll come home this evening, lots of TLC, and then we'll see her back, hopefully all recovered. Okay? This is the first time I've met Daisy's owners, although they've been coming to us for a while with their previous dogs who have treated, and it's lovely that they trust us so much to look after their pets. It's really nice. We're just going to take a blood sample before her general anaesthetic to check that her liver and her kidney is fine, and she has had a history of pancreatitis, so we just kind of want to just double check that there's no flare-up of that as well. Good girl. So if these are all okay, she can have her general anaesthetic and we'll take those lumps off. There's no signs of infection, inflammation, changes to the liver or kidney, and we don't, which is perfect, so we're fit for surgery. Good girl. So you can see the scar from her previous surgery where she's had some mammary tumours removed. Today we're going to remove these big ones that are around here, and actually it is also in this one. So what I'll probably do is take these tumours out and we take the whole mammary area away because they can spread to each other. We're hoping that it's benign because the other ones were sent away and they were benign, but even so they can still grow and become quite nasty. So while she's relatively fit and healthy, we want to get them off. Daisy's lumps tend to be more focused around the most, what we call the caudal ones, so the one closest to the back end. And in that area, there's some big blood vessels. So that will be more tricky to remove, but hopefully we'll get everything out. It's only small, but there is a little pea-sized lump there. It's down here as well, so we'll have to go a bit further down. Okay. We want to just try and avoid almost taking off too much that we can't close. We're going over an area where there's been some scar tissue before, so I can already see under here, I can feel the stitches from the previous surgeries when she had her mammary tumours removed before, so I can feel all the stitches there. So there's a lot of scar tissue, so it's a bit harder to get where you need to. And in the mammary area, there's lots of blood vessels. So the aim is that we get rid of the tumours, we get all the mammary tissue off, whilst trying to mitigate any bleeding as we go. We've removed the first teat that we needed to that has the little tumours in, and now we're going to the one furthest to the back end, which is the one that contains the most tumours. And this bit's a bit more tricky because we're going more towards the dog's groin. So naturally there's a lot of fat and blood vessels that are in here. Daisy was a rescue dog, so she was never neutered. She was actually probably used as a breeding bitch. So it's put her at being susceptible to getting mammary tumours, which she has, but she's got some lovely new owners who really want to protect her, and you know, she's having this surgery and they trust us to try and make sure that they don't cause her any more bother. Okay, so we're just about to remove all the tumours now. And there they are. All off and time to close up. Last stitch. Yeah, we are all done.
Daisy will recover with lots of TLC for the next few hours.
Good girl. Hello. Good girl.
Daisy's now fully awake after her tumour removal surgery, and Louisa is about to reunite her with owners Tom and Lynn.
We're ecstatic to get her back, aren't we? Absolutely ecstatic. So it's brilliant. And so, you know, all things being equal, that'll be it. She'll recover now and be all right for the rest of the time.
Daisy's mum and dad.
Come on.
Oh. There she is.
Hello. Are you okay? Hello.
She's been good as gold.
It's a good job. No, I can hear you.
All the stitches are inside and dissolvable. Right. She's just going to be, as expected, a little bit uncomfortable because it's quite tender in that area because it's kind of connected to your back end a little bit.
Right, okay.
She's going to be drowsy and sleepy tonight because she is 10. No jumping up. She can be carried. Well, she's very lucky to have you both. All right. See you later. Bye.
Thank you.
It's so lovely to see them be reunited with their owners because it's really stressful having the owners at home worrying about them when they're here all day, and it's the best part of the day when they get to go home.
Come on. Good girl.
Hello. Hi.
It's been a week since Merlin had his shattered front leg amputated.
Oh, that's healed so nice.
Owner Jason has brought the brave 2-year-old for a post-surgery checkup with Louisa.
So he's adapting really well at home?
Everything you would expect, yeah. I'm quite surprised how quick he's up on his feet.
Is he still wanting to jump up and off things?
He jumps on the sofa, yeah. I got a shock. Second day home, I opened the cage door and he jumped out, a bit like a rabbit. He's been remarkably well, so he's definitely back to his normal self.
How did little Lily take to having him at home?
Oh, she's loving him. She just wants to cuddle him. Obviously, when he's in the cage, she just wants to get in with him.
Oh, what a treasure. Right? The wound itself is looking absolutely gorgeous. There's no swelling, there's no infection. It's looking really nice. Should I pop you on the floor to have a look at how you walk? Want to have an explore? Merlin is very chilled. He's recovered really well so far and he's dealing with 3 legs so well. He's just got no pain whatsoever. Oh, I'm so pleased for you and for him. There's no reason why he can't live to a ripe old age, having 3 legs, being a normal cat and even being a normal outdoor cat if that makes him happy.
Yeah.
Oh, sweetheart. You big softie, honestly.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.